Hello people, welcome to Choco Millionaire. Thanks for tuning in. If you're watching this video on my YouTube channel, kindly consider subscribing and hitting the like button. So drop your comments and let me know what you think and what videos you'd like me to make. Remember, you can also join my community on YouTube by being a member as well. So kind of a shocking news is that the United Kingdom, UK, has actively stopped recruiting health workers from Nigeria. The UK has stopped recruiting health workers from Nigeria. This is quite a sad news to a lot of people who are planning to migrate to the UK. All right, so this news, how did it develop? And what is the backstory? For a lot of people who don't know what this means, the UK is one of the top destinations or preferred destinations for health workers. Obviously for a couple of reasons. One, it is more structured and more easier for people to move to the UK as health workers than a lot of other countries in the G20. The UK, for example, has a whole immigration program, a tier of visa for health workers who can migrate from other countries, especially the developing countries, to the UK and work. The statistics show that Nigerian health workers actually come in place as the top 3 in the entire UK when it comes to health workers there. We have India and Pakistan at the top, but Nigeria comes in as number 3 for the top number of health workers working in the UK. So it means that UK's healthcare system actually relies heavily on Nigeria and a couple of other countries out there. Now, this is not a decision, just to be clear. The decision to ban or to halt the active recruitment of health workers from other countries, especially Nigeria, is not one that the UK government took lightly. It was actually one that came from the World Health Organization. Basically, the World Health Organization has a way of tracking countries to monitor their recruitment policies towards other countries, especially the developing countries. And there are so many things that a country has to be compliant with when it comes to recruitment of people outside, especially in a very organized way using recruitment agencies. To cut everything short, the World Health Organization put the UK on notice that, hey, they have to take actions to make sure that they are not drawing health workers who are trained from these countries, especially Nigeria. Now, if you're also monitoring the development in Nigeria, this is coming at a time that the Nigeria passed a bill. The bill is at advanced stage right now, which actually seeks to restrict health workers, especially medical doctors and nurses, from leaving the country or emigrating to other countries unless they work for up to 5 years in Nigeria. If you're a doctor or a health worker, like a nurse, midwife or so, you are not able to move out of the country unless basically you are bonded. You have to work for about 5 years in a country before you move out. Look at the timing. So the timing of this legislation in Nigeria and then what is happening from the UK makes it extremely difficult for a lot of people to migrate there. Now, some people might be thinking, what could be the implication of this for Ghana, for my country where I'm from, and other countries as well in Africa? Now, it's a long list, yeah? And if you look at the list, you actually find that Ghana is actually also likely going to be on the list soon, because we have a lot of nurses or health workers, doctors as well from Ghana who also migrate to the UK. So let me just quickly run through the list of countries here. Other countries are Liberia, Madagascar, Malawi, Mali, Mauritania, Mozambique, Niger, Pakistan, Papua New Guinea, Rwanda, Samoa, Senegal, Sierra Leone, Solomon Island, Somalia, South Sudan. We have Sudan itself. We have Togo, we have Tuvalu, we have Tanzania, we have Uganda, we have Yemen, we have Zambia, we have Zimbabwe. And then, look, Ghana is up there on the list as well, right? Meaning that very soon it's going to get to the 10 of these countries that I just mentioned as well, because they're on the list as well, right? Now, what does this mean? If you are a health worker looking to migrate to the UK, what does this mean, people? First of all, It means very, very, very little in one part, and it also means something big in another part. I will explain. You see, the UK is one of the few countries in the world where they have actually institutionalized the recruitment of health workers from other countries. In other words, they have all these institutions and recruitment agencies that actually make it easy for people to recruit health workers and bring them here. Now, if you've watched my videos, I've actually praised the UK for making the recruitment of workers much easier as compared to Canada. Now, in Canada, we don't have a structured recruitment policy, which is spearheaded by the government, right? And then run by immigration. We don't. So in the UK, you can easily actually go and work straight for the government through agencies that are sanctioned by the government. That is why this particular red flag, all right, alert from the World Health Organization actually makes it difficult for the UK as an agency or as a government to actively go and recruit people or entice people or make offers to people through agencies. Now, on the flip side, what it also means, which is a good news, is that you can actually still migrate to the UK. The only thing is that you don't have to do it officially through recruitment agencies that are linked to the government's national health system. In short, so long as you are the one doing it by yourself, moving by yourself, without anybody, any recruitment agency linked to the government, you're good to go. My people, that's what it means, right? If you are doing it through the government of the UK, then you are restricted. And if you're a Nigerian watching me right now and you are going to apply by yourself, go find your own job, your own healthcare, work at a company there or an institution there and apply yourself, and then they give you the letter, you are good to go. In short, you as a private individual can apply on the same visa and go to the UK. And the World Health Organization will have nothing to do with that. Why? Because you're doing it on your own. You see that? But if you want to do it through the government of the UK, through the sanction agencies, that is where it becomes a problem. So that is a leeway that you can get around it, okay? It's not that bad. It's not that bad as the news is making it look, okay? All right. Now, the second side of this is that it's also likely to affect the government of Ghana. You know, recently the government of Ghana entered into this agreement with the UK government to supply nurses and blah, blah, blah at a fee. Most likely, this is going to affect that policy. Most likely, very soon, it's also going to affect that policy. So if you are also a health worker from Ghana and you are looking to, you might want to step up your own, initiative of trying to get a direct job from the employers in the UK instead of going straight through like official channels, agencies that are all linked to, the national health system there. All right. Now, what I also think this means is that you're going to have a lot of people who may have previously targeted the UK wanting to move to other countries like Germany, other countries like the United States, and countries like Canada. In Canada, they've actually started making it more easier for people, health workers, to actually move here, especially nurses. It's much easier to move to the province of Nova Scotia right now if you are a health worker from Nigeria. And if you watch my videos in the last few days, I did a video where I actually showed you guys how the province of Nova Scotia in Canada has single-handedly made it extremely easy for internationally trained nurses from the country of Nigeria again in the news, to come and work. I'm not sure whether they're also going to be put on a red flag. I don't know. But for me, this is the province of Nova Scotia making this move. Basically, they made it easier for people to migrate in there, right? And I think people are going to be looking at Canada more. People are going to be considering Canada more. People are going to be moving more to the United States as well because it's much easier to work in the US as well. Wow. Thinking of it, how come the United States is not on the list? How come? Because in the US as well, we have all kinds of agencies that are working. And I'm bringing in people, to come and work. Avan is one of them. There are so many agencies in the US who are all licensed to, linked to health institutions there. So how come they are not on the red list? How come is the UK that's on the red list? Anyway, that's a question for us to explore. But don't panic. Hey, just go through and apply to the companies yourself directly, and then you get away with it and you still get your visa to go to the UK and work, okay? And I'm not sure what to make of the bill that is at advanced stage in Nigeria, which seeks to ban health workers from leaving the country until they work for 5 years. You can drop your comments down there and let's know what you think. Nonetheless, this is not the kind of news that people are expecting. You may have seen flashes of this on social media, and it will be exaggerated at some point in some way. But just make sure you are paying attention to the details there. You can still move to the UK if you're a Nigerian as a health worker, a doctor, or a nurse. All you have to do is to go straight to the companies and apply yourself, instead of going through the official channels that are sanctioned by the government, which makes it look as if it is the government of the UK that is actually enticing you to come and work. And you're not going to have issues with this. This is Choco Millionaire. Thanks for watching this video. Peace out. Bye-bye.